Hey guys, I just wanted to talk to you guys about a possible procedure you might see or come across and just what things to have ready at bedside for your physician. We're going to talk about a retrograde urethrogram, otherwise known as a RUG, that's checking for urethral injury. This is a procedure that's done by the physician, but you need to make sure and have supplies at bedside for your physician. So this is with your trauma patients that might have pelvic injuries and they're concerned for possible urethral injury. They might do what's, like I said, called a bedside RUG, retrograde urethrogram. You're going to want to make sure you have, at bedside, you have a 50 ml cath tip syringe. You need to have lube, sterile gloves. We have these clamps that we're going to use. Those are actually out of the recess supply room by the train of 4 box. There's these clamps. Also, you want to grab, I always call it the red rubber Foley, but it's a 16 French Foley that has a 5 ml balloon in it, and that's going to be back in your diagnostic C supply room up here, 16 French. You'll have that at bedside. You'll also want to go ahead and grab a Foley kit and have a Foley kit at bedside. You're also going to need to call radiology and get the contrast that the physician has ordered for the retrograde urethrogram. So the physician will do the procedure either at bedside, or they can take them and do it in the radiology suite. They will take the Foley and actually inject contrast into the urethra, just through the urethral tip, using your cath tip syringe. And then they'll use the clamps to actually clamp that Foley to hold the contrast in place. They'll do an x-ray, and they're looking for extravasation of contrast outside of the urethral tract. If they do not see any issues, the physician then can insert a Foley. I would suggest, for best practice, that if there is concern for urethral injury, that a physician should be the one placing the Foley, not a nurse. Make sure you have the Foley at bedside, and then anticipate that you're going to take them to CAT scan and do a CT cystogram. That's just making sure you have your regular standard Foley kit with the full Foley in place. And they'll inject contrast there in CT. Also anticipate that that's going to be at least 30 minutes, sometimes an hour, for them to inject contrast into the bladder. They're checking for bladder injury, looking for leakage of contrast outside of the bladder, and then also making sure that the bladder empties all of that contrast. So you as the nurse and need to anticipate they'll be in CT for at least 30 minutes to an hour, and also you need to strictly check those I's and O's and make sure all of the contrast was emptied out of the bladder.